Welcome to part 3 of our training series focusing on hepatitis, a critical topic for anyone working in addiction treatment. Hepatitis is a significant health concern in populations affected by substance use, and understanding it is key to providing comprehensive care to our clients. In this session, we'll cover the different types of hepatitis, how it spreads, why it's common in addiction treatment settings, and what you, as a healthcare provider and a therapist, need to know to prevent, identify, and manage it. Hepatitis refers to the inflammation of the liver and has a significant history, especially in relation to public health. There are several types of hepatitis, but the most relevant for those working in addiction treatment are hepatitis A, B, and C. Each type of hepatitis affects the liver differently and spreads in various ways, but they all have the potential to cause serious liver damage if left untreated. Let's take a closer look at these types of hepatitis and explore some historical events to put it all in context. Hepatitis is far from a modern disease. It's been around for centuries. The term itself originates from the Greek word hepar, meaning liver. The first recorded epidemic of hepatitis occurred in 1912 when soldiers in World War I contracted what we now know as hepatitis A, transmitted through contaminated water and poor sanitation. Hepatitis B was later identified in the 20th century with a breakthrough in 1965 when Dr. Baruch Blumberg discovered the hepatitis B virus. This discovery led to the creation of the hepatitis B vaccine, which has been a game changer in preventing the disease. In the 1980s, hepatitis C was finally identified and recognized as a distinct type of hepatitis transmitted primarily through blood, which is why it's so closely linked to injection drug use. In addition to hepatitis A, B, and hepatitis C, there are other strains of the hepatitis virus, hepatitis D and hepatitis E, and each of these strains impacts the liver, but they differ in how they are transmitted and their geographic prevalence. So here's a quick breakdown of the lesser known strains. Hepatitis D, also known as the Delta virus, is a rare form of hepatitis that only occurs in people who are already infected with hepatitis B. It relies on the hepatitis B virus to replicate, making co-infection necessary. This form of hepatitis is more severe than hepatitis B alone and can lead to a faster progression of liver disease. Hepatitis E is a strain that's typically spread through contaminated water, similar to hepatitis A. Hepatitis E is more common in parts of the world with inadequate water sanitation, such as areas in Asia, Africa, and Central America. It usually causes acute infections, and while it often resolves on its own, it can be serious for pregnant women and people with weakened immune systems. And while hepatitis A, B, and C are the most commonly discussed types, it's important to recognize that hepatitis D and E also pose significant health challenges, particularly in certain regions or populations. Recognizing the signs and symptoms of hepatitis is critical for early detection and treatment, particularly in addiction treatment settings where many individuals may be at higher risk. The symptoms can vary depending on whether the infection is acute or chronic. In cases of acute hepatitis, such as hepatitis A, B, and E, individuals may experience flu-like symptoms, including fatigue, jaundice, or a yellowing of the skin and eyes, and abdominal pain, particularly on the right side of the abdomen where the liver is located. Other common symptoms include dark urine, pale stools, nausea, vomiting, fever, and loss of appetite. These symptoms often appear suddenly and can last for several weeks. On the other hand, chronic hepatitis, which is typically associated with hepatitis B and C, can be much more insidious. Many people with chronic hepatitis may not exhibit any symptoms for years, allowing the virus to cause silent but progressive damage to the liver. When symptoms do appear, they often include persistent fatigue, weakness, joint pain, and ongoing abdominal discomfort. As the disease advances, individuals may develop swelling in the legs or abdomen due to fluid buildup, easy bruising or bleeding, jaundice, and in some cases, cognitive symptoms like confusion or memory problems, particularly if the liver begins to fail. Chronic hepatitis can ultimately lead to severe complications such as cirrhosis of the liver or cancer if left untreated. It's important to distinguish between acute and chronic hepatitis. While acute hepatitis often resolves on its own, especially in the cases of hepatitis A or E, chronic hepatitis B and C can quietly lead to long-term liver damage, including fibrosis, cirrhosis, and even liver cancer. Because chronic hepatitis can go unnoticed for years, regular screening and early interventions are vital to help preventing severe outcomes. So let's jump into a more recent historical event, one that highlights the importance of food safety and public health in preventing hepatitis. In 2003, there was a massive hepatitis A outbreak lead to a now defunct restaurant chain. Can you guess what chain it was? This outbreak became the largest hepatitis A outbreak in the US history, with over 600 people infected. The cause? Contaminated green onions served in a Pennsylvania restaurant that's near Pittsburgh, specifically at the Beaver Valley Mall. Tragically, the outbreak resulted in 4 deaths and hundreds of hospitalizations. The fallout was huge, not only for public health, but also for the business. The restaurant chain eventually filed for bankruptcy, and the outbreak tarnished the brand's image permanently. The FDA traced the green onions back to a farm in Mexico, and they could have been contaminated because of inadequate sanitation or hand washing, poor hygiene among workers, or irrigation of the crops with untreated water. And there were a lot of variables along the way as to how it got this bad, but the damage to the restaurant's name had already been done. So, were you able to think of what restaurant chain this was? It was Chi-Chi's. And the outbreak just really highlights how rapidly hepatitis A can spread in public settings when proper food handling and hygiene practices aren't followed. It also reminds us of the broader community impact of hepatitis outbreaks, whether they're linked to restaurants, homeless shelters, or healthcare settings. When hepatitis becomes chronic, meaning it lasts for more than 6 months, quietly can cause significant damage to the liver over time. Chronic hepatitis is most commonly caused by hepatitis B or hepatitis C, and while someone may feel it fine for years, their liver could be facing ongoing inflammation, and here's what that could look like. There could be liver scarring called fibrosis. The liver is a resilient organ, but with chronic inflammation, it starts to form scar tissue. Think of it like a cut on your skin healing, it leaves a scar. If the liver is constantly being damaged by inflammation, it can't heal itself properly, and over time, scar tissue builds up. Next is cirrhosis. After years of damage, the liver becomes severely scarred, which is called cirrhosis. And at this point, the liver can't work the way it should. It struggles to filter out toxins out of the blood, making proteins for blood clotting, or producing bile, which helps digest fats. This can lead to symptoms like fatigue, yellowing of the skin, called jaundice, and swelling of the belly or legs. Liver cancer is also another thing to watch out for in chronic hepatitis. Both hepatitis B and hepatitis C increase the risk of developing liver cancer over time. This usually happens after the liver has been scarred for many years, but in some cases, liver cancer can develop even without severe scarring, especially in people with hepatitis B. We also want to consider liver failure. If cirrhosis becomes advanced, the liver can fail, meaning it stops working altogether. This is life-threatening and can cause symptoms like confusion, extreme fatigue, and severe swelling in the abdomen due to fluid buildup. At this stage, people often need a liver transplant to survive. And there's other body effects from chronic hepatitis. It doesn't just affect the liver. It can also impact other parts of the body. For example, people with hepatitis C might experience joint pain, skin rashes, or kidney problems too. And this happens because the immune system gets confused and starts attacking other parts of the body, not just the liver. Chronic hepatitis can also make the immune system weaker over time, leaving the body more vulnerable to infections. This is especially concerning for people who already have other health problems. The good news is that hepatitis C can now be cured with modern medications, and hepatitis B can be managed with treatments that prevent the virus from doing more damage. The earlier it's caught and treated, the better the outcomes are for long-term health. Treating hepatitis depends on which type you're dealing with, but the goal is always the same: prevent the virus from causing serious damage to the liver and help the body heal. For hepatitis B and hepatitis C, treatments are particularly important because they can either control or cure the infection. So let's take a look at the main treatment options, how they work, and their potential side effects. For hepatitis C treatment, it can be cured with medications called direct-acting antivirals, or DAAs. These drugs target the virus directly, preventing it from multiplying and allowing the liver to heal. DAAs are usually taken in a pill form for 8 to 12 weeks, and they have a high success rate, curing about 90% or more of people who complete the treatment. Common medications for hepatitis C include Epiclusa, Mavorite, and Harvoni. Side effects of DAAs are generally mild but can include fatigue, headache, nausea, and mild gastrointestinal issues. Most people tolerate these treatments well, and because they're highly effective, they can prevent the long-term complications of hepatitis C like cirrhosis or liver cancer. While hepatitis B isn't curable, it can be managed with medications that keep the virus in check and reduce liver inflammation. People with chronic hepatitis B usually need lifelong treatment, but with the right medication, they can live long and healthy lives. Common medications for hepatitis B include, and I've actually never even heard of these, so I don't know how they're pronounced. If you're really curious on how they're pronounced, I would recommend Googling it. But these drugs work by reducing the amount of the virus in the body, which helps to prevent liver damage. They're taken daily as pills, often for life. Side effects of hepatitis B treatments might include headache, dizziness, nausea, kidney issues with the long-term use of some medications. Regular monitoring by a healthcare provider is important to watch for any long-term side effects and to ensure that the virus remains controlled. And for hepatitis A treatment, there's no specific medication because the body is usually able to fight the virus off on its own. Hepatitis A doesn't become chronic like hepatitis B or C. Instead, treatment focuses on relieving symptoms and ensuring proper rest, hydration, and nutrition while the liver heals. If you or someone you know is at risk for hepatitis or has been diagnosed, great local resource is Central Outreach Center in Pittsburgh, Pennsylvania, and they have multiple locations around the state. Central Outreach provides comprehensive testing for hepatitis B, hepatitis C, HIV, and other STIs, and they also offer supportive care and guidance for anyone who tests positive. They can connect you with treatment options you need, whether it's the DAAs for hepatitis C or long-term management plans for hepatitis B. In addition to medical treatment, Central Outreach focuses on harm reduction, offering services like needle exchange programs and education on safer practices. Their goal is to help individuals stay healthy, manage their conditions, and reduce the risk of further transmission. If you're unsure about your status or need support, Central Outreach is a trusted and caring option to get started on the path to better health. For people working in addiction treatment, understanding how hepatitis spreads is crucial for prevention. Hepatitis B and C are mainly spread through blood. In addiction treatment centers, this can happen through needle sharing, contaminated drug equipment, or exposure to blood during medical procedures. Hepatitis A can spread through unsanitary conditions, so maintaining hygiene in communal areas is essential. Hepatitis and substance use disorders are often closely linked, especially in the case of hepatitis B and hepatitis C. Many of our clients may be unaware that they are infected because these types of hepatitis can be asymptomatic for years, all while causing liver damage. For individuals who inject drugs, the use of non-sterile needles dramatically increases the risk of transmission as blood-to-blood contact is the primary method for both hepatitis B and hepatitis C to spread. However, needles aren't the only method of transmission. Anytime blood-to-blood contact occurs, there's a risk. For example, sharing straws for snorting drugs can also lead to transmission, especially because the nasal cavity is full of tiny blood vessels. When people share straws or other paraphernalia, even microscopic amounts of blood can transfer, potentially spreading bloodborne pathogens like hepatitis B or C. And it's estimated that over 70% of people who inject drugs have been exposed to hepatitis C at some point, making this a major health concern in our population. In Allegheny County, there were over 1,000 confirmed and probable cases of chronic hepatitis C reported in 2020 alone, with a majority affecting people involved in high-risk behaviors like injection drug use. Clients with co-occurring hepatitis and substance use disorder may face several barriers to care, the first one being stigma. Clients may fear judgment about their hepatitis status, especially if they are already dealing with the stigma associated with addiction. They may lack access to testing and treatment. Many clients may not have regular access to healthcare, and without consistent medical attention, hepatitis can go undiagnosed for years. We also want to watch out for co-infection with HIV. Hepatitis B and C are more likely to occur in individuals who are also living with HIV, further complicating treatment and care. Because of the high risk of transmission, harm reduction practices such as needle exchange programs and education about safe drug use are vital in preventing the spread of hepatitis B and C among people who inject drugs. Offering vaccinations for hepatitis A and B can also be critical. One of the most effective ways to prevent hepatitis A and B is through vaccination. Hepatitis A and B vaccines are safe and highly effective, and they're especially important for individuals in high risk groups, such as those who inject drugs or those experiencing homelessness. Providing clients with access to sterile needles, syringes, and other drug paraphernalia can significantly reduce the risk of hepatitis transmission. Needle exchange programs and supervised injection facilities have been shown to lower the rate of infection and promote safer practices. Educating clients how hepatitis is transmitted and encouraging them to get tested regularly is key. Make sure clients understand the importance of not sharing needles and other drug related equipment and emphasize the availability of confidential testing and treatment options. Regular screening for hepatitis B and C is critical in populations at high risk. Early detection can prevent further spread and allows for timely intervention, which can prevent long term liver damage. Hepatitis C can now be cured in most cases with antiviral treatments, so linking clients to care early can have a life saving benefit. And again, in the Pittsburgh and surrounding areas, Central Outreach is a great resource for medical testing, and Prevention Point can help with harm reduction efforts like needle exchanges. For clients who test positive for hepatitis, managing the infection in conjunction with substance use treatment is crucial. There are effective treatments for both hepatitis B and C, like we discussed. Hepatitis C can be cured with direct acting antiviral medications, and those are often recommended for people with substance use disorders. Treatment for hepatitis B typically involves antiviral drugs to control the virus, though it's not curable. Many clients with hepatitis also have co occurring health conditions like HIV, liver disease, or mental health disorders. It's important to coordinate care across multiple services to ensure that they are receiving comprehensive treatment. This may involve collaboration with infectious disease specialists, mental health providers, and addiction counselors. Clients with substance use disorders may struggle with adhering to long term treatment regimens. Working closely with clients to support adherence through case management, medication assisted treatment, and providing access to stable housing and healthcare can greatly improve outcomes. So, here's a case study that we'll talk about. I encourage you to pause here and think about these cases and identify any additional treatment options that you might recommend. So, a client in your treatment center tests positive for hepatitis C during routine screening. The client admits to sharing needles occasionally and is unsure about seeking treatment due to fears of side effects. Ideally, you would want to identify harm reduction strategies, including access to clean needles and safe injection practices. Educate the client about modern hepatitis C treatments, which are generally well tolerated and highly effective, and emphasize the importance of completing treatment to prevent liver damage. What else might you offer at this point for this client? And here's another one. A 40-year-old male in your care has both hepatitis B and HIV, and his viral loads for both are high. The client has been struggling with medication adherence and sporadically attends appointments. And we didn't really talk about viral loads here, but basically what this means is he can be considered highly contagious, and likely his liver is being affected. So, the recommended approach here is to create a coordinated care plan involving the client's primary care physician if he has one. If he doesn't, let's get him one, an infectious disease specialist, and an addiction treatment team. Focus on improving adherence by addressing barriers like unstable housing or substance use triggers, maybe even transportation too, and provide support through case management and peer support groups. And can you think of anything else you might add for this client or recommend or suggest? So, to wrap up all three parts of this training series, remember we talked about tuberculosis, we talked about sexually transmitted diseases, and this last one was on hepatitis. I just want to remind you of the importance of what we've covered. Each of these topics presents unique challenges for the individuals we serve in addiction treatment settings, and by staying informed, we can make a real difference. As addiction treatment professionals, it's essential that we understand how TB, STD, and hepatitis are transmitted and identify risk factors within our client populations. Recognize the early signs and symptoms so we can intervene quickly and effectively. use prevention strategies like vaccinations, harm reduction practices, and regular screenings to keep our clients healthy. Offer ongoing support by addressing the barriers our clients face during treatment and helping them access the care they need. Now that you've completed all three parts, don't forget to submit your quizzes if you haven't already. Afterward, be sure to talk to your supervisor about receiving your training certificate. Thank you for sticking with me throughout this training. I know listening to hours of my voice wasn't easy, but the knowledge that you gained will have a real impact on the health and well being of our clients and community. So let's take what we learned and continue to make a positive difference together. Thanks.